Bunion is hereditary. It runs in the family, or it can be caused by the tight footwear. And the bunion usually occurs in the big toe, that is the big toe, and it occurs in the joint called metatarsophalangeal joint, where the bone grows at the joint and which pushes the toe inward. And when the bone grows around this metatarsophalangeal joint, it rubs against the foot, and which causes inflammation and the pain. And sometimes, if its rubbing is going on for a long time, it can cause even tiny ulcers on the skin. And bunion can be uncomfortable, and they usually give a lot of pain. They are tender to touch, and it affects people's physical activities, like it's not possible for them to run because they can't push off, and other activities. It affects other activities. Treatment options for the bunion are twofold. One is non-surgical and another is surgical. So non-surgical option is to have a shoe which has got a wide toe box, which are wider at the front, and insoles which can be customized or non-customized insole to accommodate the toes in the shoe. And that is a non-surgical treatment. And of course, if there is a pain and inflammation around, taking non-steroidal anti-inflammatories helps the symptoms as well. And also, along with this, some restriction of physical activities helps to cure the symptoms. The second is the surgical option. And in surgical option, what is done is we break the bone, which is called osteotomy, and realign the bone, and then the bone takes its time to heal, which is usually 6 weeks. And sometime, in order to allow the bone to heal in a proper environment, the small plaster is applied around the forefoot part of the foot, approximately 6 weeks. But full recovery from the operation can take up to 3 months.